101.7 Citizen FM.
Good morning, everyone. Welcome to a fresh episode of Health Focus, your health and wellness enlightenment program on Citizen FM 93.7 Abuja. My name is Catherine Aduola Abimbola, your regular anchor. On today's episode, we are looking at epilepsy, and our doctor is already on hand, Dr. Sonia Mbachu, a general practitioner. Our social media handles: Twitter is at Health Focus NGR, YouTube is Health Focus Nigeria, email healthfocusnigeria@gmail.com, WhatsApp is 07040282777, and our Facebook page is Health Focus Nigeria. First on the lineup, let us listen to the news tidbits by Njideka Anikaizi.
Welcome to the news tidbits on Health Focus. My name is Njideka Anikaizi. The federal government says it will ensure that fertility regulation is implemented across the state of the federation to break down barriers of women's access to reproductive health services with a view to achieving a secure society and sustainable development. The Director, Family Health Department in the Federal Ministry of Health, Dr. Salam Ibrahim Anas, stated this at the National Interception Meeting of the Women Integrated Services of Health Extension WISH project in Abuja. Dr. Ibrahim Anas explained that as government's commitment to strengthen the policy of National Health Framework, 1% of the state and the federal government's health sector budget had been dedicated annually to family planning. The World Health Organization, WHO, in collaboration with Borno State government, has embarked on house-to-house enlightenment campaign on monkeypox, COVID-19 vaccine, and cholera in 4 local government areas of the state. They are Maiduguri Metropolis, Jere, Mafa, Kodunga, and other hard-to-reach areas. The WHO Emergency Manager Northeast, Dr. Richard Lako, in an interview with journalists in Maiduguri, said 27,000 households are expected to be covered during the month-long campaign, and that 30 community health champions had been engaged to sensitize the targeted communities. Dr. Lako explained that following reported suspected cases of monkeypox in Borno and Adamawa State, there was a need to step up the sensitization to contain the disease. An active case search had been intensified to prevent its spread. The federal government has introduced the rotavirus vaccine into the nation's immunization schedule to address the high rate of diarrheal disease in children caused by rotavirus. This is to make sure that every child accessing routine childhood immunization at any primary healthcare facility should also be vaccinated with the rota vaccine free of charge. Rotavirus is a highly contagious virus that causes severe diarrheal disease amongst infants and other children all over the world. According to the World Health Organization, WHO, more than 500,000 under 5 children suffer from severe diarrhea each year, leading to 215 deaths globally, and more than 90% of these deaths occur in developing countries such as Nigeria. President Muhammadu Buhari has inaugurated the Nigeria End Malaria Council in Abuja with a view to eliminate the scourge and expected to save the nation from the estimated economic burden of the disease, with about 7 billion naira this year and 2 trillion naira by 2030. President Buhari, who explained that Alhaji Aliko Dangote was chosen as the chairman because of the recognition of his track records and passion to always support initiatives on various health issues, would help the country achieve its goal of malaria elimination. The chairman, Nigeria End Malaria Council, Alhaji Aliko Dangote, pledged to work hard to achieve the mandate. That's the end of the news tidbits. Please stay tuned for the rest of Health Focus. I am Njideka Anikaizi.
Now, let's hear what some Abuja residents know about epilepsy.
Epilepsy, when there's a seizure, then you begin to throw saliva out. They claim that it can contact it if you have the fluid.
Epilepsy occurs as a result of a genetic disorder or an acquired brain injury.
Epilepsy is like, when someone is kind of convulsing or you see someone in the ground.
Epilepsy, it traumatizes the brain.
Epilepsy is disease that
like a shock to people, and most people doesn't like associating with people with epilepsy.
I know that it has to do with when that white foam is coming out of the mouth. Then there are some epileptic diseases that can be affected because of camera, like flash to the eyes.
Some people, when they suffer from the epilepsy attack, they probably just lose consciousness and then they start shaking, and sometimes they bringing out stuff from their mouth. And a rumor that we heard, when someone has an epileptic attack, you should put spoon between their mouths so that their teeth will not touch, because if their teeth should touch, they will die.
Epilepsy, I used to see it common when I was younger among my classmates in primary and secondary school. So I know there's a superstitious belief about it, and I don't know the scientific reason, but it will be good to learn about it.
Okay, doctor is here as I mentioned earlier, and remember we said we are discussing epilepsy today. Dr. Sonia Mbachu, you are welcome to Health Focus.
Thank you so much.
Thank you for always coming each time we call you.
Please don't mention, I'm glad to.
Thank you. Please, doctor, what is epilepsy?
Okay, epilepsy, seizure disorders, that's like a better name for it, yes. But it's basically a neurological disorder. That means a disorder of the brain that arises as a result of multiple, what I call it, misfiring of cortical neurons in the brain. So basically, I know what most
that one
people,
is medical English, so if you can help us.
Yeah, that's the thing. So basically, it's more like the brain usually, how it functions, it sends impulses right to the rest of the body. Yeah. So when those impulses are now misfiring at an abnormal rate, okay. So like typical example of what the layman will understand epilepsy to be is maybe you see that individual that suddenly falls on the ground and starts jerking. Yes, although that is just like one type. All right, there are other types, so that's why we call them generally seizure disorders. All right, but then if you want to narrow it down, epilepsy is more like when you have 2 or more seizures occurring at least 24 hours apart and there is no identifiable cause. That is when you now call it epilepsy.
Okay, so what are the causes of epilepsy and what are the symptoms?
Okay, so basically epilepsy just presents as seizures, all right? And there are different types of seizures. For instance, there's one we call absence seizures, even though it's more common in children. So you can just see a typical child just staring into space for like 5 to 10, sometimes 15 seconds. That's already a seizure.
Really?
Then there are some that you can have just continuous rhythmic movements, maybe hand rolling, lip smacking. Like I said, there are different presentations. We call all of them seizures, but there are different presentations. Then you have the more dramatic ones, if I may say so, the stiffness of the muscle or those jerky movements. Yeah, so they present in different ways. But causes, like I said, when you don't have an identifiable cause, but you see someone coming down with seizures, having 2 or more, at least 24 hours apart, that's what we call epilepsy. But then, of course, there are risk factors. So, for instance, let's say in childhood, you have a patient that maybe had a prolonged fever, what we call febrile seizures in childhood. So if it has been prolonged and maybe there is an additional genetic disposition, such person can later in life come down with epilepsy. Then of course you have like they mentioned, the genetic disposition. So there are some patients that in their family you get to see epilepsy. So scientists have been able to track epilepsy to some particular genes, but of course for us here in Nigeria, it's just for you to present with the symptoms, then we know that, okay, you have such a condition. Then you can also say if someone has had a previous head trauma in the past, or what we call head injury. So it may be a direct insult to the brain, or it can be from a traumatic incident, for instance, like accidents, road traffic accidents, and or like I said, a traumatic insult to the brain from infections like meningitis, encephalitis, from maybe repeated metabolic diseases. So the patient is always having maybe hypoglycemia, hyperglycemia.
What is that one?
That's very reduced blood sugar, very raised blood sugar, so diabetic patients. So when you have that like for a long period, and then maybe after a while you see a patient just presenting with seizures and there is no identifiable cause, but by the time you take a patient's history and you begin to elicit these things, so like I said, these things can predispose someone to having epilepsy. But of course, at that point where the patient is having seizures and you can identify a cause, meaning you can tell, okay, this is the reason why the patient is having a seizure. So maybe the blood sugar is low, the blood sugar is high, or maybe you check for the electrolytes in the body. These are more like minerals, sodium, potassium here and the rest. And maybe one is very high, very low. There are some of them that present as seizures. For instance, sodium, what we call hyponatremia, that means the sodium level is very low, or hypernatremia, that means it's very high. All right, so there are sometimes the patient will come in and you can identify why the patient is having the seizure. But when you have a patient come in and you cannot identify, but maybe as you take the patient's history, you now realize, okay, maybe at a particular time in the patient's life, the patient's brain was exposed to some form of insult. Yeah. So have conditions that predispose to epilepsy. But epilepsy itself, like I said, is when you have a patient with 2 or more seizures at least 24 hours apart and no identifiable cause. That is when you can now call it epilepsy.
This is very serious, because the idea of epilepsy that I have is that that person must fall down more than 4 times in a day and must come, there should be foaming, spit and all that.
No, it's not that. Like I said, it's not always that dramatic. That tends to happen more with generalized seizures. So let me just see if I can make it a bit understandable.
Please do.
So we have what we call focal seizures and we have what we call generalized seizures. So focal seizures, remember I said earlier that those neurons in the brain are misfiring. So if you have that misfiring coming from just one section of the brain, so maybe the frontal lobe or maybe the temporal lobe, that's by the side or behind, if it's just coming from one part, that's when you can have focal seizures. And most times focal seizures are really not that dramatic. All right, so sometimes the person can just have this phenomenon of what we call deja vu, or maybe just be in a state of temporary confusion. Yeah, sometimes it happens with loss of consciousness. Sometimes the patient is conscious. All right, so those seizures are just coming from a focal point. Then you now have generalized seizures that is coming from virtually every part. So, but generalized seizures still, not all of them present that way. So we have the ones we call tonic seizures, meaning the patient is just stiff. If you touch the patient is very stiff. Most times if the patient is lying down, they can fall from the chair. Then there's what we call atonic seizures. So there's this sudden paralysis of the leg. This patient just suddenly drops. Then you now have the tonic-clonic. That's the one that is very dramatic, that you see the patient stiff and jerky, and at that point they can lose bladder control, so the patient can urinate on his or herself. You can have that excessive foaming. You can have the eye rolling movement. Sometimes it may just be the eye rolling that will let you know the patient is having a seizure. So like I said, there are different presentations of it. It's just for you to be attentive and knowing that this patient is bound to have such things, so you look out for such. But then you can have a situation where it's a first time occurrence and you can't really explain. So you might see someone just staring into space. You're thinking the person is maybe having a deep thought, not knowing the person is actually experiencing a seizure.
Really?
Yes. So it can happen that way. So the better we are informed about these things, the better you can get to interpret some abnormal behaviors you see some persons express. Yeah, so it just lets you know that this actually may not be normal. So you might just want to tell the person, why don't you just go check in, all right, just to be sure that everything is okay.
So now, which group of people, age group, can go through these seizures, epilepsy?
Sometimes it can occur in children, and of course it can occur in adults, but most times we see it more in older adults, that's adults above the age of 35, and then in children. But most times we realize that in children, except they have a genetic predisposition, there's usually a cause. So it can be from the prenatal period. So maybe the child while in the womb, the mother had some infection or was given to alcohol, drugs, and all that. So the baby is born, the baby is already having that brain insult, because while the baby is in the womb, the baby is prone to brain insult or brain injury, or probably during delivery, if the woman maybe had a difficult delivery and you had a lot of what we call kepha hematoma. So if you notice, there are some children that are born and you notice a huge bulge maybe at the back of their head. Yeah, sometimes that can be bleeding, all right, due to maybe a trauma, or so there are several things that can happen during the birthing period that can predispose the child's brain to an insult. So as the child grows, the child can start having those seizure disorders. But like I said, most times they are identifiable causes in children. Once in a while, there's an epilepsy we call benign childhood epilepsy. There's no cause, and most times we realize that children tend to outgrow it, especially that benign childhood epilepsy. As they tend to outgrow it after like 14-15 years of age. You rarely see them come down with seizures anymore. Yeah, so it can happen in children. Of course, like I said, older adults too. So for older adults, maybe there's a vascular abnormality in the brain, but it's just that, for most of the cases I've seen, I won't really call them epilepsy, because they always come down with identifiable causes. So either there's a brain tumor, there's a vascular abnormality, that's the blood vessels, maybe what do you call this? An aneurysm, that's a brain aneurysm, or there's always an insult. It's rare for you to now see someone that, comes down with a seizure and there is no identifiable cause. But like I said, most times when you trace the patient's history, either in childhood there was a brain insult, or at some point the patient maybe was into drugs and then stopped. Yeah, so there's most times when you trace the patient's history, there is always a predisposing factor.
Okay, is there a relationship, convulsion and epilepsy?
That's the lay term for seizure, convulsion. Okay. Yes, that's the lay term. You hear someone say, my child is having convulsion, that is actually seizure. So that's like the lay term. That's what people understand.
Most mothers believe that for any child, you mentioned something similar to it earlier, that if a child has prolonged fever, they will come down with convulsion.
Yes, most times they do. And it occurs with children that are between like 6 months to 5 years of age. Above 5 years, you rarely see a child that has a fever and is coming down with seizures. So between that age of 6 months, in fact, in pediatrics, there's this phenomenon we call febrile seizures, like I mentioned earlier. So you see a child between 6 months to 5 years has a fever, comes down with seizures, classical febrile seizures. So what you're just looking at is what is causing the fever. Once you're able to treat it, in fact, the child may not even have any other seizure episode apart from that initial one. That's why most times we tell mothers, when you have children between 6 months to 5 years in your house, always have paracetamol. All right, even if you don't have paracetamol, once you notice the child is beginning to have a fever, expose the child, depistone the child, and then bring the child to the hospital. Don't just say this child is having fever, then you leave and say, okay, maybe later in the evening I'll buy maybe malaria drug. No, always have paracetamol or ibuprofen syrup. I mean, these are things that you rarely see overdose of them. So, but at least for the safety of the child, always have them, so that your child is coming down with a fever, you administer. Then I also advise women to always have thermometers in their houses, so that you can actually check for yourself, because there are certain degrees the temperature would get to and the child is actually prone to having seizures. So for instance, fever between maybe 37.5 to like 38 may not really come down with seizures. But once you start having 38 point something, 39, even 40, there's an increased risk. So at that point, just expose the pit sponge, give paracetamol if you have, rush the baby down.
Doctor, I'm still a bit confused. Maybe too much of stories being told, or some Nollywood being watched, where you see somebody fall down, jack, then they say don't move close, and the next thing the person is foaming at the moment. From this explanation, that epilepsy is not that.
No, I'm not saying it's not that. It can present that way, but it's not always that way.
Okay.
It's not always that way. In fact, the thing with movies is that sometimes they exaggerate things, all right? Okay. It's not all the time you will have that foamy. Sometimes, like I said, the patient just collapses on the floor. You can't tell, we're just sudden paralysis of the legs. So it must not be that dramatic way.
All right. Okay, having said that, is it treatable? Is it curable? And is it something that is just restricted to the Africans, so to say.
No. This is something that is worldwide. I mean, you have epilepsy spread across the entire globe. It's not an African problem. And I would say the one seizures with causes, once you treat the cause, you've treated the seizure. But like epilepsy, like I said, when you don't have an identifiable cause.
That means it doesn't have a reason.
No, actually, we have anticonvulsant therapy. We have anticonvulsant drugs that we give to them. And the moment they take it judiciously, there's less incidence of that epilepsy. I remember I said there are some children that just outgrow it after a while. So, studies are still ongoing about epilepsy. So, but basically there are drugs that can help tame the seizure. So someone on medications may not even have an episode for months or even years, as long as they're judiciously taking it. Then another thing we advise is avoid triggers. There are identifiable triggers that can,
such as?
Yes, that can trigger an episode in epileptic patients. One, which is most important, lack of sleep. Yes, lack of sleep. If you're epileptic or you're prone to seizures and you're not sleeping well, it's terrible. So that is like a major trigger. Then alcohol, all right? Alcohol, major trigger also. Then what we call emotional stress. So anxiety, panic, so any form of emotional stress or maybe even stress in general. Those are triggers, all right? Then, of course, like we said, there are some other things. Avoid maybe low blood sugar, very high blood sugar. We just tell them, just live your life normally, but just avoid triggers, all right? Eat well, exercise properly, and take your medication.
And sleep well.
Sleep well, yes. So you're good to go.
Okay, is it contagious?
No. Epilepsy is not. Even if someone is having an episode, like what we do, we just advise people, ensure that there is nothing harmful around. Yes, then this one goes to Nigerians, or should I say Africans, do not put anything in the patient's mouth. Yeah, so we've had scenarios where a patient with epilepsy is brought to the hospital and they said they had to, either they mixed onion with one oil or sometimes, or
an hot spoon.
And it ends up injuring the patient, right? So the most that can happen to an epileptic patient when the patient is having an episode is maybe the patient bites his or her tongue. Now that can be quite severe because the tongue is well vascularized, so you can have some form of bleeding. Then maybe as the patient falls, he hits his or her head, or maybe slight injury. So that's why we say, if the patient is having that seizure episode, like just ensure that the surroundings there's nothing harmful around, okay? And just see how best you can. Okay, now the thing is, there's what we call status epilepticus, meaning the patient is just convulsing for more than 5 minutes without stop. So you just have to rush the patient to the hospital. But of course, seeing such a thing is already alarming. So the next thing in your head should be, how can we take this patient to the hospital? So, but you see those putting of stuff in the mouth. I mean, the patient can even bite you. Yeah. So just avoid it. Just take the patient to the nearest hospital. Once the seizure is aborted, the patient is already fine. It's just to now progress and see, okay, what next can we do for the patient and what is causing it. Yeah.
Okay, now it can happen to both genders.
Yes, both gender, any race, any tribe, any origin can happen.
Has it happened before to a woman that is pregnant?
Yes, pregnant women can come down with epilepsy. So women that...
What triggers that?
Yeah, well, like I said, epilepsy itself, like I said, has no identifiable cause. So let's say a woman that is epileptic, she's known to be epileptic, and then she's pregnant. At that point, is a high-risk pregnancy. That is part of what constitutes high-risk pregnancy. So such women, their hospital visits are more frequent than the others. Then, of course, we're looking at her drugs. Okay, pregnancy, not every drug is safe. So we give the safest drug that is safe for both the mother and then the baby. Like I said, frequent hospital visits. Then, at this point in time, the triggers has to be totally avoided, because if a woman, for instance, imagine a pregnant woman having that kind of dramatic tonic-clonic seizures, the baby is at risk. You're at risk of placenta abruptio, and also it's something that we treat delicately. Okay, so that's a high-risk pregnancy on its own. Of course, there's a pregnant woman that she's not epileptic, not known to be epileptic, but while being pregnant, she has a traumatic brain injury. That can also happen. Another classic one, and I'm glad you even mentioned this. I don't know if you've heard of preeclampsia and eclampsia. Yes, so this is the major cause of seizures in pregnant women. In fact,
break it down and explain.
Okay, so what we call preeclampsia is hypertension in pregnancy, okay, but with other factors added. So you check the woman's urine, there is protein in her urine, right, and then you have the elevated blood pressure. So while it's still preeclampsia, of course, there's risk of seizures and all, but at that point, most of the symptoms you may find is just maybe headaches, leg swelling, apart from, of course, the growing fetus in the abdomen, but you can tell that there's some form of fluid retention and all. Then, of course, the protein in the urine. But once it gets to eclampsia is just preeclampsia plus seizures. So you see a pregnant woman, she's jerking seriously, you check the blood pressure shooting to the roof, protein, like 3+ of protein in her urine. That is pure eclampsia. At that point in time, the baby has to be delivered by the quickest, safest route. All right, because what will save the woman at that point is to deliver the baby. Yeah, so preeclampsia on its own is like a major issue in pregnancy. Like that is the whole cause on its own. So if the hypertension is controlled well enough, it may not progress to eclampsia, and the woman can carry her baby to term. In fact, what we advocate is once the pregnancy gets to 37 completed weeks, just deliver. Either you do a CS or we induce and the woman delivers. But once it gets to eclampsia, that's the woman she's having seizures, we deliver that baby as soon as possible, like the quickest, safest route. Yes, quickest possible route. We just deliver the baby because the high blood pressure is coming from more like an abnormal communication between the placenta and the woman's system. In fact, there's a whole lot. The pathophysiology is not even well understood because there are several factors that have come into play when we talk about preeclampsia. In fact, there are different predisposing factors per se. So, but for women, if you see a woman having seizure, it's either she has been epileptic before, but the most common, the one we see most frequently in the hospital is classical eclampsia.
Still talking about epilepsy, what is the death rate?
It's very, very low. By years of being a medical doctor, most of the patients that die are actually pregnant women. And like I said, it's because of that eclampsia, not like pure epilepsy like I've explained. Yes. So, but to see someone who dies from epilepsy is rare. The death rate is actually very, very low. I think the last study I read, I think I saw like 0.9%, although that's for the US. I'm not sure. We've conducted a recent study on epilepsy in Nigeria, but the death rate is very, very low. It's when there's an identifiable cause. So for instance, you have someone that has suffered a stroke coming down with epilepsy. You have someone that has a metabolic disease and all that. Those are the ones that most times they can die, but it's not the seizure itself that kills them. It is the cause, what is causing the seizure, that ends up being the cause of death.
Okay, so for any seizure or any epileptic person, we should try to help, not to run away.
No, please don't.
It's not contagious.
No, it's not contagious. Don't run away. Just help the person as soon as you notice someone, either collapse in front of you or is having such jerky movement. Just help. Don't put anything in the patient's mouth. Remove any dangerous or harmful objects around the patient and call for help. That's just the best you can do.
Thank you so much, Dr. Sonia Ambachu. It's always a pleasure when you come to us and you give us detailed information about any medical issue. Thank you. We hope to see you again soon.
Sure. Thank you so much.
Dr. Sonia Ambachu has really opened our minds to what epilepsy is all about. And as I always say, please don't mock anybody with any medical condition. Please, let us help ourselves. Let us give ourselves support in any way that we can. And we should make sure at any point in time we visit qualified registered medical facility. Please remember to send me your questions on our social media platforms. Twitter is at healthfocusngr. Email is healthfocusniger@gmail.com. WhatsApp is 07040282777. Our Facebook page is Health Focus Nigeria and our YouTube is Health Focus Nigeria. Until next week when we come with another topic, I am your regular anchor, Catherine Aduola Bimbola, saying thank you for listening and bye for now.
Ignorance of the law is not an excuse. Most times, people commit one offense or the other due to ignorance and negligence. Some get into one trouble or the other out of ignorance. Wheel of Hope, a human rights advocacy program on Citizens FM 93.7 Abuja, is here to educate you on issues that relate to your fundamental human rights, tenancy agreements,